Hey everyone, thanks for joining today. It's Dr. Jarrett. I'm here on my normally Tuesday afternoon, 1 p.m. Eastern Standard Time live stream. Basically pediatric topics that go on here, there, all the time. Every week you guys can send me messages about topics you would like me to discuss, but I'm going to be here. I will say the first thing off today, before we even get into our topic, just knowing that my heart and my prayers are going out to all of Houston and Texas and Louisiana, who are having all the flooding from the hurricane last week and the continued rains that have resulted. I know it's a very difficult time. I've lived down south and gone through a couple of hurricanes, namely Andrew was one, and it was tough, but it's nothing like what we've seen with Harvey. And my thoughts and prayers have been going out to you guys. I know I have some good friends and family down in the Texas area, so please be safe. Please stay updated on what your local authorities are saying about when it's time to move. I know they've been doing everything they can, but when something so disastrous has occurred, it makes it very tough. So certainly my thoughts and prayers go out. I was just out in Pittsburgh, as some of you guys may know if you follow me on some of my other social media channels at Dr. Jarrett, just to check out the city a little bit, take in a little football, little time with my family, which is always nice. You have to take that time with your family to really unwind. So I was out there. I'm going to be on the road again this later this week, but I wanted to make sure before I took off I would give you guys my weekly live stream, which is very important because the topic today is going to be about high blood pressure. So I'll get into the topic in just a little bit. I want to allow as many people that can get in the room to fit in the room. So come on in the room, everyone. Come on in the room. We'll get you guys in and we'll get started in just a minute. But back to the hurricane and what's been happening down there. It's just devastating on so many different levels. You have to look for your safety primarily. But then all of the trauma that comes afterwards, and maybe I'll have an upcoming live stream about just trauma in general and the way it affects the kids' health. But certainly you can message me on my Facebook page and let me know what you guys think and what kind of topics you would like to hear from me. Again, a couple more people are joining us, so before I get fully started, just letting you guys know that I'm Dr. Jarrett. I'm your board certified pediatrician. I'm here to help you transform your child's health. I'm going to do that through my books, my live streaming, and other programs I'm going to deliver to you to help transform your child's health. All I want in return is for you guys to go to my Facebook page at Dr. Jarrett. Spell out Doctor, J-A, 2 R's, E, 1 T, and like that page and follow it. You'll get updates at least daily on a lot of things going on. Certainly I've had a lot of media coverage recently, particularly if you have younger kids. Make sure you check out the page because I have lots of baby and toddler articles recently that have been cited in the media, simply because there are lots of questions when you guys first have babies out there. So you'll find all of those articles on my Facebook page at Dr. Jarrett, and you can go through my feed and find some of those. We talked about baby bottles recently, anxiety in children, and a number of other topics that are going to be timely for you guys. Today's topic is going to be a little bit more aimed at older and school age children that have there, because what we're going to talk about today is high blood pressure. I know you typically think about high blood pressure in adults because that's where you see it mostly. But believe it or not, 3 or 4% of all children do have elevated blood pressure. The reason I'm talking about it now is that the American Academy of Pediatrics just released new recommendations last week based on hypertension or high blood pressure. So we'll go through some of these. It's a very comprehensive document. All you pediatricians, family physicians, and people that take care of kids, make sure you take a look at that document. Has lots of good information, and it is updated, so you'll need to really take it in. So I was able to read it and digest it a little bit, and I want to bring it to you, for you parents out there, to know a little bit more about high blood pressure. So first of all, people ask me, what is blood pressure? Well, why do you even have a blood pressure? And that's simply defined by the pressure of the blood being pumped through your veins and arteries by having the pressures inside those vessels, blood vessels. Sorry. One of the things that I'll say is that your heart acts like a pump and is constantly pumping all of the blood throughout your body, and your arteries and veins, or your blood vessels, are like pipes and deliver that blood to all different parts of your body. So everyone does have a blood pressure. The significant piece is if it's a high blood pressure. Low blood pressure can lead to things as falling out or passing out or feeling lightheaded or dizzy. This happens particularly if you're dehydrated. But high blood pressure is something more chronic, and it's not even something you can feel. That's why it's been known as the chronic silent killer, because you don't have chest pain associated, you don't have aches, you don't necessarily have swelling, you don't have any signs, particularly in children. The really only way to get a diagnosis is by being seen at your physician's office and getting that blood pressure checked. One of the many things that you'll have to know is that high blood pressure in children is different than in adults. And in adults, they've used the numbers 140/90 for quite some time. And those numbers signify the systolic pressure, which is that top number, and the diastolic pressure, which is that lower number. And those values range in between 140, or should be under 140/80 or so, or 90 or so. But in children, the blood pressure fluctuates based on your age, your height, perhaps even your weight. So there's a whole variety of tables that your child's doctor must use in order to diagnose high blood pressure. So make sure, one, at their yearly physicals, that their blood pressure is being taken. And it can be done with a traditional arm cuff. It can be done with a automated cuff, maybe even a wrist cuff. But make sure that it's being taken. And it may need to be taken over several different times. One of the things that you'll need to know is that the blood pressure, when it's high, leads to very serious conditions such as strokes, heart attacks. It can cause kidney disease. So there's a lot of things that can happen as a result of high blood pressure. So over long periods of time, the effects get greater. So if a child starts off with high blood pressure, you're going to want to make sure that it's being followed and perhaps treated. And we'll go into that a little bit. There's another type of high blood pressure that people do talk about, and it has to go with this thing I have on here, this white coat. This white coat that I have on is something they call white coat hypertension. So it's something that sometimes makes people nervous. In general, it makes kids uneasy to wear a white coat. So often in the clinic setting, you won't see me in a white coat because it makes the kids feel nervous. But there has been demonstrated to have a little bit of elevated blood pressure as a result of just being nervous and anxious about the physical exam or your doctor's visit in general. So you have to make sure that that blood pressure is taken. And really, you know, if I give a number like 124/76, that doesn't sound so bad. In fact, I wish my blood pressure would run in that range. But for a child, say a 10-year-old child, that actually could be elevated blood pressure. We're seeing a lot more elevated blood pressure from children, and a lot of it is also linked to being overweight or obese. So you know that physicians all over have been really emphasizing keeping a healthy weight, because that leads into high blood pressure, that leads into strokes, kidney disease, heart attacks, all the things that we've talked about that can really make things rough for your child in the long run. And these effects may come earlier and earlier in life, depending on how high these numbers are and how poorly it's been treated. So your doctor can't just see your child one time, take a blood pressure reading and say, oh, that's a high blood pressure, I think they have hypertension, we're going to need to treat this or do something with it. It actually takes a little bit more than that. It may take a series of visits. You may even want to take the blood pressure at a few times during the visit, simply because that your blood pressure will fluctuate from time to time, minute to minute. So you certainly will come back probably for a couple of different visits. Your doctor may also recommend you get your child's blood pressure taken at another outside site, so perhaps a pharmacy or something, depending on the child's age, because again, with pediatrics, you have to have very specific equipment to deal with the children. So you can't have a cuff that's too big or too small, because it won't read the blood pressure properly. Nonetheless, you may be instructed to go get that somewhere else, and you may want to get that reading done and bring that list of readings into your doctor. But if your child has had high blood pressure for a longer period of time and it has been followed over a few visits, you may need to have your child treated. The first order of treatment is typically just the usual healthy dietary changes. So you're going to want to make sure your child's at a healthy weight. If they are overweight or obese, we're going to want to work with you in getting the weight a little bit lower. Ways to do that is, of course, through exercise and what the child is eating, the diet. So needless to say, exercise is something that every child should have for at least 1 hour a day, every day. They should be able to play freely and get their exercise that way. Older kids may be in some sort of organized sports or some type of dance or any types of things that they may get their exercise. And that would count easily as 1 hour a day if they're getting that done every day. If they're not in organized sports, make sure you're just letting them have free activity and they're not sitting right in front of the TV or playing electronics for long periods of time. They need to get that activity. And then through dietary modifications, I mean, it's the stuff that we've known about for forever. You're going to want to make sure that there's a reduction in salt intake. Sodium is one of those things that's been linked to high blood pressure in many people. So you're going to have to read those nutrition labels. But furthermore, there's something you can look up. It's called the DASH, DASH, DASH diet. That DASH diet is something that really emphasizes fruits and vegetables, lean proteins like chicken or fish, and very low fat. So that's a great diet that everyone should be on. But the DASH diet, dietary approaches to stop hypertension, is something that would be good for the entire family, particularly if high blood pressure runs in the family, which can make your child more at risk for having high blood pressure. So using that DASH diet, it's certainly something that is healthy for everyone. Again, lots of fruits and vegetable servings. You're going to get a little bit of dairy, 2 or 3 servings a day, but you're going to get 4 to 5 servings of fruits, 4 to 5 servings of vegetables. You're going to get a lower sodium intake, as well as lean proteins, which would come from fish or chicken or other protein sources. Thanks for joining the room, everybody who's been here today. Certainly, again, I'm Dr. Jarret. I'm your board certified pediatrician, helping you get better health over your child and transforming their health. And I'm going to do this through my books, my live streams, my other programs that I'll make available for you. I just want you guys to go to my Facebook page at Dr. Jarret. Spell out Dr. J-A, 2 R's, E, 1 T, and like my page and follow my updates. Today's topic, just as a review, is high blood pressure in children. We talked about blood pressure and high blood pressure, and high blood pressure has to be diagnosed through your child's doctor's office, and it may take a few visits to diagnose, and it's not a specific number like 140 over 80 in adults. It really ranges based on the child's height and their age. So you're really going to have to work with your child's doctor to look at those measurements and make sure that they're being seen and measured appropriately with the right equipment, which may mean a pediatric size cuff for a younger child. But we were just talking about high blood pressure and it being a silent killer. It's one of those things that you're going to need to make sure you're out there with your kids and know your family history, simply because it can lead to strokes, heart attacks, kidney disease, a lot of things that can really be very devastating to your child or their adult life. So finally, we were talking about the treatments for it now. If you've tried increasing exercise and you've tried dietary changes and then you've noticed your child is losing some weight, they're also getting better exercise tolerance, the blood pressure very well could come down on its own just with those simple modifications. The reason is, as always, kids are more resilient than we are as adults. They really can do some things that help make them get better faster. That's one of the reasons I was drawn to pediatrics, is that kids really get better faster when they are sick by large parts. However, if simple changes in diet, if simple changes in exercise, increasing exercise, isn't effective to bring that blood pressure down into the safe range, you're going to want to make sure you're getting some care and follow-up by your physician. There are different medications that can be used for high blood pressure, and they've been on the market for many, many, many years. And if your child fits in one of the categories that needs to have some treatment, it's very safe to do so. These medications have very little side effects, and they've been studied in children as well for quite some time. So in the worst case scenario, they may need to be tried on a medication or a couple of different types of medications simply to bring that blood pressure down. Now remember, as we said from the beginning, they're not going to be able to feel their blood pressure is high. They're not going to know that their blood pressure is high. There's no real symptoms with high blood pressure. It's the silent killer because it takes some time for the effects to set in, which leads to strokes, heart attacks, kidney disease, among many other things. But keeping them with healthy lifestyles, keeping them away, especially the teens, away from tobacco products, smoking, drug use, all of those things will lower their risk for having high blood pressure. Certainly eating healthy and exercising regularly, at least 1 hour every day, if not more, will also reduce their chances for blood pressure, having high blood pressure. So high blood pressure is something that is found in 3 to 4% of children in the U.S. We have new recommendations by the American Academy of Pediatrics, who has really laid out a great plan for us as pediatricians to follow and work with you as parents to help monitor your child's blood pressure. We also know that blood pressure leads to early death, strokes, cardiac events like heart attacks. And the treatment can be simple. If your child does have high blood pressure, it's going to be mainly increasing exercise and activity and looking at dietary changes, lower in the sodium, higher in the fruits and vegetables, using lean proteins. So finally, thank you guys for tuning in. As you know, I'll be here every Tuesday, 1 p.m. Eastern Time. I have a new topic every week. Just find me on Facebook at Dr. Spell out Dr. Jarret, J-A, 2 R's, E, 1 T. And I'm here every week, Tuesdays at 1 p.m. I'm your board certified pediatrician, here to help you transform your child's health. And I'm going to do that through books, through my programs, through my live streams. I'm going to be here with you, helping you transform your child's life and lead them to better health. So thanks for tuning in today. Like my Facebook page at Dr. Jarret, spell out Dr. J-A, 2 R's, E, 1 T. And I'll see you guys next week. Thank you.